a 24-year-old woman comes to emergency department due to lower abdominal cramping and vaginal bleeding. What is the age of the female? It is a 24-year-old female, and the complaint of the female, it is a abdominal cramps and vaginal bleeding. The patient started to have vaginal spotting a few days ago but has had slightly increased bleeding with painful lower abdominal cramping since this morning. I mean, female already have the symptoms of the spotting, but now she has a huge bleeding with the cramps. Well, lower cramps, and it's increasing this morning. She is sexually active and her last menstrual period was 5 weeks ago. When was his last menstruation? 5 weeks ago. Blood pressure is 130/80, which is normal, and pulse is 100, which is little bit raised or normal. Diffuse tenderness to palpate is present over the lower abdomen. Tenderness is also positive. Lower abdomen. On specular examination, the cervix is closed and there is dark red blood coming from the cervical os. Which type of the blood? Dark red blood is coming from the outside of the os. Bimanual examination reveals a small uterus and 3 cm mass in the left adnexa. Small uterus and left adnexa, 3 cm mass. Beta HCG level is 1200. And what is your diagnosis? What is the most likely cause? Or now,
ectopic pregnancy, sir.
How you will think that this is ectopic pregnancy? Good.
Beta HCG के उसमें बहुत ज़्यादा होता है, sir.
For ectopic pregnancy, you have to focus on how many things. For example, just as we discussed this question, that this female have the mass onto the left adnexa, like a mass-like structure. Number one. Number two, the menstruation of this female was 5 weeks before.
Yes,
so this is basically showing that the normal menstruation within 4 weeks. Yes. So 1 week has gone above the normal menstruation days. So we will say it is a amenorrhea. Amenorrhea, mass. Number three, also there should be history of sexual activity. And in the question there is also mentioned this female is also sexually active. 3. Number 4, that if a female have the ectopic pregnancy, beta HCG level should be raised. And in this question they also mentioned that the beta HCG level is raised. Number 5, that the blood is coming outside. It is not a clinical picture of every patient of ectopic pregnancy, but you can see rarely in some patients. So according to this statement, the right answer is your ectopic pregnancy. So we will say that how implantation of fertilized embryo in the fallopian tube. And what is the definition of ectopic pregnancy? The main definition of ectopic is outside of the uterus. So the right answer is the implantation of a fertilized embryo in the fallopian tube. It can be endometriosis or no? Yeah, it can be endometriosis or no? This question. No, it can never be the endometriosis. Why? Because in endometriosis you can see also the uterus will be little bit small in size, and other than that the painful urination, dysuria, dysmenorrhea, dyspareuria, these are the clinical pictures, are the clinical feature of the patient of endometriosis. So there's also an option was that endometriosis. So this is the wrong answer. And the torsion of the ovarian mass. How we can say that it is a torsion of ovarian mass? Because the picture of the patient of the torsion of ovary will present to us with acute and sudden episode in emergency, with sudden acute episode with severe pain, with nausea and vomiting, unilateral, and sometimes there is also examiner mention about the fever. So the right answer is implantation of a fertilized embryo into the fallopian